Welcome back, everyone. Diabetes is one of the most common health conditions in the U.S., but it can quickly turn serious if blood sugar levels get too high or too low. Here to help us understand what to watch for is Layla Martinez, nurse practitioner at Exceptional Community Hospital in Yuma. Now, many people hear about diabetes, but what exactly does it mean, and why is it so important to understand it?
So diabetes is a condition where the glucose level is irregular, and whether that can be too high or too low, and it just has to deal with the pancreas, either giving too much insulin or not enough.
Now, what warning signs should people look out for as far as blood sugar levels or anything that compares to that?
So if sometimes people have an increased thirst, or they'll have confusion, or they'll have increased urination, and those are signs usually that they should go to the ER and get checked out if they don't have a glucometer that they can check their blood sugar at home.
Is there any type of symptoms that are maybe a little less serious that raise some flags? Maybe I should go see a doctor?
Yeah, and that's usually if you're feeling more thirsty than usual and you are drinking a lot of water, if you're losing weight, if you're just feeling fatigued, definitely get it checked out.
And then again, do you mind restating those symptoms for those maybe experience something a little bit more serious and it's time to head to the emergency room?
Yes, if you're having any chest pain, shortness of breath, or just really confused or fatigued, definitely get it checked out and come into and get some labs done at the very least.
Would you say, is there any certain stigma behind diabetes that some may feel is a little, that you kind of want to clear up at all?
Yeah, a lot of people think that it has to do with people being overweight, but it can actually happen to anybody. There's two different diabetes. There's type 1 diabetes and type 2 diabetes. Type 1 is where the pancreas stops allowing for insulin production, and that's usually caught in early childhood. And then the other one is usually later on in life. Type 2 diabetes can be related to diet. It can be related to being overweight. It also can be genetic. So those are just some things to bring up with your primary care doctor, or like I said, if you're having any of those symptoms, you can come in and get checked out, either with us or your primary care.
Layla, is there anything else you want to add about diabetes today?
So if you do have diabetes, I think it's very important for you to have just a simple sugar on you, like a 15-gram either juice, or they sell glucose tabs. That way, in an emergency, when you are feeling, some people do feel low, meaning their blood sugar is dropping and they feel shaky, and then they can just take the sugar, feel a little bit better, follow it up with 15 grams of protein, and usually they're okay. But if it keeps happening, or it's happened for the first time, you should get evaluated.
Absolutely. Layla, thank you so much for joining us in studio. Again, if you've missed any certain details today that you'd like to check again, you can head to our website at kyma.com, or of course, just always call your doctor. Be sure to stick with us for some more news.